much for joining us tonight again. We're really, really excited to have you all here. This is actually, I just realized, the last educational class of the year. So really excited. We're going to wrap up the rest of 2025 with a fantastic speaker and topic. We have, again, some great things coming up within the next couple of months. I was going to bring it up, but I'm just going to give you all a little bit of a sneak peek as well. Something really exciting that's going to be coming through the woodwork very soon, specifically for So Do We and the program. The leaders specifically, hopefully you remember the playbook that you all got at the beginning when you first signed up. There was a very specific page in there called Change Makers. This is a very fun program within So Do We that's really kind of giving you that momentum to do what is really what you need to do to be successful within this campaign. So they're very easy steps like completing your volunteer hours, your education hours, and fundraising requirements as well. And if you complete all this, there's some really cool benefits and perks like letters of recommendation, signing off on more service hours, being the ability to come to the house to hold meetings, the opportunity to be at the top of the list for the premier volunteer opportunities. Specifically, that one would probably be Blue Jeans Bow Tie because that's what everyone wants to go to. But some other great things might be coming through very, very soon. I'm just giving you a little hint, hint, nudge, nudge. Check your emails. Check your emails, read your emails. There's a very, very exciting opportunity that's going to be happening specifically for So Do We students that I'm not going to ruin the excitement yet, but read your emails. But we're just going to go ahead and jump right into everything. Again, really excited today to have a great guest speaker from Ulman Foundation, from Ulman House. I've one of my favorite people at Ulman Foundation. I love bugging her as much as I can. But I'm really excited to welcome tonight Kim Weiner from Ulman Foundation.
Awesome. Thank you so much, Andrew, for that lovely introduction. You're never bugging me. Hi, everybody. So nice to, I was going to say see, but so nice to meet all of you. I just want to start off by just saying thank you for what you're doing. I know how hard it is to take on extracurricular work, volunteer work, and what you're doing is amazing. And you're helping so many people by being involved in the So Do We program. So just thank you so much for what you're doing already. Andrew, if you can pull up they're perfect. I'm excited to share some information with you tonight about the impact of cancer that is on the AYA, the adolescent young adult patients and their families. Like Andrew said, this is the heart of what we do. My role at Ulman, if you want to go to the next slide, I'm our Chief Impact Officer. So that means that I oversee all of the programs at the organization. Where Andrew's working on the fundraising side and raising the money, I'm working on the side to make sure that we are putting it to good use. So I have a team of folks that I know you've probably already learned about Ulman House and our patient navigators in the hospitals. I'll talk a little bit about that tonight as well. But all of that work that we're doing is really ensuring that no one faces cancer alone. And I am, if you've ever heard of a mission moment, I'm going to be also the speaker and the mission moment tonight. So when I was 22, I did face cancer alone. And I was diagnosed with melanoma. I had just graduated college. I went to Salisbury University. If anyone's looking there, go Seagulls. And as soon as I graduated, I moved to Columbia, Maryland for my first job, got my first apartment, and went to my and I at that point had not seen a dermatologist in years. And I decided to go, as adults do, went to a dermatology appointment, and the first thing that they saw was a mole that looked really bad, and they said, "We have to remove this." And it came back a few weeks later that it was stage 2 melanoma. And for those that aren't familiar with melanoma, it is a highly aggressive, they call it the most dangerous form of skin cancer. And if you probably can't see on this screen, maybe in the picture, but I grew up going to the beach in New Jersey. I have light skin, freckles. I've always worn sunscreen, but it's with melanoma, a lot of times it can be hereditary, but absolutely your environment can impact it as well. So for me, getting that diagnosis at 22, right when I was getting into the next stage of my life as a young adult, was terrifying. And being the type A, just go-getter person I am, I was like, all right, well, I just got to figure this out. So, 4 surgeries later, it took over 9 months for me to fully heal. The melanoma was on my back, so I couldn't take care of the wound myself. Um, I was asking coworkers to help take care of me. I was living by myself. I was asking people that lived in my apartment building. Like it was really a nightmare, from just a managing pain and just taking care of myself perspective. And as you can imagine, which we'll talk about tonight, like I really got depressed and really sad and to a point where I just felt, why me? Why did this happen? And when I was done with everything related to my treatment, which for me was surgery, they were like, you're good to go. Just wear sunscreen, look out, come to your, at the time I was going to the dermatologist every 3 months. Now I go twice a year. And it was something that when I look back, I wish I didn't have to do that alone. I wish I had known about the Ulman Foundation where I could talk to somebody, really handle my mental health. That was something that I did not take care of. As soon as I was healed, I got right back into running. I started like physically taking care of myself, but it was that mental health component that was missing. Um, Thank God, years later, I got into therapy and looked out for myself. But that survivor's guilt, that is a term that you might have heard before of people asking that, why me? Why did this happen? It was something that took years for me to really come to terms with. And I truly think that if I had known about the Ulman Foundation and connected sooner at that point in my life, that would have been a completely different outcome for me. So I've always been in the nonprofit field. I am so lucky and fortunate that I have a job where I can give back professionally, and support the mission of this organization. But personally, it means so much to me because I know what it feels like when no one's there to support you during a cancer diagnosis and the impact it has. Um, so I'm just going to pause there for a quick second before we go into the presentation. Does anyone have any questions about anything that I shared or anything they want to ask? We can, and you can hold it till the end too, but just figure I'd take a moment. Okay. All right. Well, if anything comes up, just know you are welcome to ask me. I'm an open book. So thank you for listening to my story and hearing me out. All right. All right. Trivia. All right. I'm gonna need people to get off camera to answer, or not off camera, but off microphone to answer this. What is the, and no Googling this either. What is the capacity at M&T Bank Stadium?
How organic produce can actually be way.
All right. I'll ask again. What is the capacity at M&T Bank Stadium? Who has a guess?
3,000?
3,000. Okay, I can tell you right now, Sandy, it is a lot higher.
60,000?
50,000, higher than that.
65,000?
Ooh, you're getting closer.
70,000?
It's who said that?
Me.
Crosby?
Yep.
Awesome. You were very close, Crosby. We're gonna go by Price is Right rules here. It is 71,000 people. So, thinking about 71,000 people, if you've ever been at M&T Bank Stadium, it's a huge stadium, right? Lots of people, always packed. Now let's think about how many young adults are diagnosed with cancer each year. Does anyone want to take a guess? Anyone?
6,000?
Six.
300,000?
Sandy, I appreciate the guesses, but it's so much higher. Who else?
Like 300,000?
300,000. Crosby, it is lower than that. Andrew, if you can go to the next slide.
100,000?
Sandy, you're getting closer now. So when we think about 71,000 people at M&T Bank Stadium, every year 89,000 young adults are going to be diagnosed with cancer. So we think about, what is that? A little over 10,000. Yeah, oh my God, math is hard right now. No, more than 10,000. What is that math? More than 10,000.
18,000 more.
Oh my God, Andrew, thank you. I can hear my daughter crying upstairs, so I'm just like trying not to get distracted. So 18,000 more people that sit in M&T Bank Stadium will be diagnosed with cancer this year. It's terrifying. I mean, you think about cancer being in that young adult range. We define that as 15 to 39 years old. That's the medical definition of that young adult age range. And it's still the leading disease killer amongst 20 to 39-year-olds. There has been a lot of advances in early detection, especially with breast cancers. Colon cancer is on the rise, but there definitely is screenings available for that. Um, There's definitely a lot more markers to watch out for with blood cancers, but there are so many cancers that people may not know they have it or they're misdiagnosed, which is a common thing that happens in the young adult age range. It's scary, but it's something that if we are aware and we can educate and we can advocate for our bodies, that if something feels wrong, go see a doctor. That is probably the biggest takeaway I have in this message is that if you or any of your loved ones just say if something feels off, go see a doctor. Um, Most of the time it will not be cancer. It's that joke, right? Like you go Google something, it tells you you have cancer. It most of the time will not be, but it's that few times of like something really feels wrong. Like that inner intuition is your best guiding star in that. Andrew, you can go to the next slide. So, Andrew, have you given some background on the Ulman Foundation to everybody?
Yes, but they could always use a refresher.
So just a quick highlight. I'm not going to go into too much detail, but this is Doug Allman. He's our founder. When he was at Brown in the 90s, he was diagnosed at 19, diagnosed with a rare sarcoma, and it was a cancer in his stomach. And again, he felt like something was wrong, and he advocated for himself. He actually had melanoma 2 times after that, and his is now doing great, lives in Ohio, but this organization was founded off of really the same principles of what you heard me say in the beginning about my story is that he looked for resources and support and it wasn't there. So he founded this organization to do that. And yes, there are organizations that still do that across the country, but we're still one of the many few that provide that wraparound support services outside of the medical treatment for young adults specifically. So I mean, simply, our mission is to change lives by creating a community of support for young adults, their loved ones, have been impacted by cancer. That is, it's a straightforward mission, and it is when you think about where you can make a small and a big impact, it's this by building a place of community. I look at this as a place of community. All of you are going to walk away that if somebody tomorrow is diagnosed with cancer that's 15 to 39 years old, you're going to know where to send them. You're helping create that community of support to change lives. So thank you again for all the work that you're doing. So I want to dive into a little bit, and I think you probably heard a few things that I said in my story about why cancer hits differently for adolescent and young adults. And this is where we're all falling into this age range. Adolescent and young adults, they're at a critical life stage, right? They're graduating school, they're starting their first jobs, they're having their first sense of independence, searching for identity, right? This is something that I am so excited for all of you, but when you go into college, when you go beyond, into outside of your high school bubble, wherever you end up going, there is a place of finding out who I am now, and it's exciting and it's also challenging. And you think about if cancer came in and you had to hop on that struggle bus of what is this now? It's very scary, and it's something that changes people at its core. Um, Relationships are looking a little bit differently, so it's really that critical life stage where things are changing quickly for everybody. And this is where too young adults fall in between the pediatric and the adult cancer systems. A lot of times this causes what we call a gap in care. So pediatric units at hospitals typically they support patients ideally up to 26. It actually goes a little bit higher than what you would think. And that overlaps with the adult programs too. So a lot of times a young adult kind of falls in the middle of that where they may be getting support from pediatric units where they feel too old for this space and they're going into doctors' rooms where Winnie the Pooh is on the wall and they're, in playrooms with really little kids and they feel out of place. But if they go into the adult system for care, they're usually with a lot older people in their 50s, 60s, and it's like this doesn't feel normal either. So even outside of that feeling that an individual may feel, those gaps in care, a lot of hospital and clinical programs don't have specific AYA programs, which is changing. But because of that, it causes a lapse in care for folks. Um, AYAs frequently have delayed diagnoses. I think my story is a good example of that, that I truly think if I had gone to the dermatologist a year or two earlier, that mole probably would have been removed and it might have been precancerous or it might have been stage one. If I had waited longer, it absolutely would have gotten so much worse for me. So those delayed diagnoses a lot of times are connected to not seeing a doctor, not checking up with your care, or a symptom may look like just stress or anxiety or sport injuries, which all can be seen as very normal issues. So that really comes back to what I said earlier about really listening to your body and advocating for yourself if something doesn't feel right. So one thing that I really like to stress with people, and it's something that if you've ever personally known somebody with cancer, it impacts the patient, the individual impacted by cancer so much, but the stress that it has on the families is immense and the impact that it has on the families. So a lot of times parents that have a child with cancer, they're balancing caregiving, they're balancing jobs, they have other children perhaps. Um, a lot of times a sibling of if their sibling has cancer, they may feel scared, left out, even responsible sometimes. I know that's a confusing feeling, but we see that a lot with younger kids of just like, well, why are they sick and not me? So kind of that just confusion of that diagnosis. And then there's also the practical burden. This is something we're going to talk a lot about tonight with really how Ulman Foundation steps in a lot, is that caregivers for patients frequently experience lost wages, travel costs, and even burnout too. So you think about if we actually had a couple check into Ullman House earlier this week. It's a husband and wife, and the husband is going through treatment right now, but the wife had to quit her job to come stay with her husband while he got treatment. And they have a 4-year-old at home that is staying with other family members, and they're not going to see the 4-year-old for 3 to 4 months while he is completing his treatment. So it's a very scary thing for families and for caregivers of feeling like they can't do it all at once. It's something that when we look at our mission of the organization, that's why we say families impact individuals and their loved ones impacted by cancer, because we know we have to support the whole system, not just the patient. So this is huge to make sure from they're seeing the impact of cancer on everyone in that family ecosystem. And if anyone here has ever tried to navigate a hospital, insurance claims, or just even decisions about care, that is so stressful and confusing. And it is a hard system. It is not something that I know I talk to doctors on a regular basis, and they're confused sometimes by the system and how things work. So that is a larger systemic problem that if you have cancer, you fit into a system that already feels broken a lot of different ways, and trying to navigate what is the best decision is not easy. And I think that is something that I look back at my own story that if I had more knowledge of the Ulman Foundation, I probably would have asked for a second opinion, or I wish someone was with me to even ask my dermatologist for a second opinion on something. I look back and 4 surgeries was a lot. Like I might not have needed that many. So again, it's something that these decisions, these outcomes, it takes a whole village to kind of support on, um, to really alleviate some of the burden that comes up when you have cancer. And then there's the long-term effects too. Um, Families often experience trauma even after treatment ends. I mean, cancer, as you can imagine, is a traumatic experience. It is something that brings up a lot of different emotions, feelings. Your body's not the same afterwards. And that trauma does kind of lead into other people around oftentimes. And when young adults return home for care, this can shift the family dynamics and independence. So imagine somebody has been living on their own for quite a few years. And now they have to go back home and live with mom and dad after they've had that taste of independence as young adult. That's a huge dynamic shift that some people are a-okay with. I know it would have been very challenging for me, which is probably why I decided to do it all my own. But it's something to be aware of that there is so much your lives change when you're young adults, and sometimes it's hard to go back to figure out what are those dynamic shifts. I'm gonna just pause there for a second. Does anyone have any questions? Okay.
I
Yeah.
I was wondering how you were able to support yourself with only your income for your treatment.
Yeah, Sandy, thank you for asking. So I think this is where I definitely was one of the lucky ones where my my treatment was surgeries. So it was very clear cut of like, this is the cost of what these surgeries are going to be. I'm not going to lie, my insurance didn't cover everything. So I did go into a little bit of medical debt for probably about a year to pay everything off. But because my treatment was surgery, it was a little bit easier to navigate than some folks that have to go through chemo or radiation or having expensive cancer drugs. That definitely like brings up the price quite a bit. Um, I also had good health insurance, which certainly helped, but not everybody falls into that boat. Thank you for asking that. Okay. So we have, Andrew, how many people do we have?
Nine, eight.
Nine. Okay. I'm actually going to keep Andrew, do you want to keep everyone here in one space or do you
Yeah,
want to put
that works.
them? Okay. So ignore the breakout group line. We're not going to do that. Um, I would love for folks to come off their to turn their microphones on. And I want to kind of just do a little brainstorm here of asking the question, what can cancer impact for a young adult? Oh, that is a badly worded question now that I'm rereading that. Apologies. How can cancer impact a young adult with cancer? Wish I could edit that on the spot. So how can cancer impact a young adult with cancer? That's so badly worded. I'm sorry, team. So how can cancer impact somebody?
Um, I think that especially like in that age group, I think your social life is very important, and when people can't really relate to what you're going through, it's definitely a factor.
Oh my gosh, Kayla, spot on. I mean, you think about if you get diagnosed with cancer and none of your friends have ever had cancer, or they know somebody that in their, immediate family that hasn't or has, it is like how can you relate to that? Like that's so hard.
Just to
I
add on, oh,
oops, sorry.
sorry.
Yes, Edith.
When
Or in
Oh, do you want
oh,
to go now?
sure. I just wanted to add on to the social life. I feel like because maybe if you're going through surgeries or if you're taking treatment and you choose to do it alone, I think that can impact how you interact with others and how your emotional learning kind of evolves.
Oh, I love how you said that. I don't know if I've ever heard the term emotional learning, but that's so key, right? Um, yeah, love that term. I'm taking that with me. Thank you. Edith, did you have a comment?
Yeah, just to add on to what they both said, in general, it really has an impact on your relationships with other people. And there are a lot of other like physical consequences. Like when you have cancer, your body changes, and some ways it's really hard to recover from that. And that's just another way, like another broad aspect of it.
Oh, absolutely. And I think that's the thing too, is that you never know how your body is going to change, and and if somebody has the same diagnosis as someone else, their outcomes of how they feel afterwards is going to be totally different. So it is such a unique thing of what's happening to your body. It's something we say at Ulman all the time. We meet people where they are, and I think that's a good example of like you have to meet yourself where you are too, and you just don't know what your body's going to feel like. All right. Any other thoughts?
I think someone's mental health can really be impacted by a diagnosis, like a cancer diagnostic, especially because having to think about how you're gonna get treatment, how it can impact your, like how the previous people said, your social life, just the people around you, how they're gonna view you or if they're gonna stay with you along your journey.
There was an article I read last week, and I'll have to find it so I can share it I'll have Andrew share it with everybody. I think it was in the Washington Post, but Andrew, if you could make a note for me to find this. But it was all about the idea of cancer ghosting, of people
I
getting
just read
diagnosed.
that too today.
Yeah. I think we reshared it. But it's all about this idea of like you have this amazing network, you get cancer, and then people start backing away from you. And I think some of it is fear, some of it is fear of I don't know how to react. I don't know how to relate to them. I hope it's not fear of being contagious because we know cancer is not contagious. Um, but that idea of just cancer ghosting is so scary and it's so real. And like we hear that from patients, unfortunately, quite often of like my network's not the same, my friends aren't the same, my family looks at me funny. Um, so yeah, your mental health absolutely suffers from that. Any other thoughts?
To add on to like the mental health aspect, I would say you also feel very isolated from other people, especially like during the treatment process when you need other people to help you, both emotionally and physically, just to like go on about your everyday life. And like just nothing is the same anymore. So you definitely feel the impact of that.
Sophia, so well said. Thank you for sharing. All right. So, Andrew, if you can go to the next slide, you all gave some great examples. This is the list I came up with. So, I just want to take a moment of everyone to kind of scan through this and would love to hear some just kind of initial thoughts of some of the things on here that maybe you didn't think about.
I didn't really think about their participation in like life milestones such as like weddings or graduations or family events even.
Oh my gosh, absolutely. We had so there's a especially with blood cancers, and there's a few other cancers where this is pretty common, but there's something called a bone marrow transplant, or you might hear it be called BMT. And a bone marrow transplant, you have this done, or even any stem cell transplants too. You have to be secluded from friends and family for up to 100 days afterwards. So we have a lot of families and people that come stay at Ulman House because they can be totally isolated from their friends and family, especially if they have little kids. I have a toddler upstairs. I'm sick every other week from what she brings home from daycare. And if I had to isolate, like it wouldn't be possible in my house. So with with treatment like that of needing to be away from friends and family, you miss graduations, you miss weddings, you miss just parties. The holidays are coming up. We will have a packed house at Ulman House. These families will not be going home for the holiday season. Um, and it's sad, and it's something that it's that participation that really can, as we think about the mental health and all everything else we said, can really have a toll on folks. So we try to make it a really fun and just atmosphere, and just know this is a period of time. It's not forever for folks. Anything else that jumps out from you from this list?
And one thing that I kind of thought of, and it's kind of a combination of a few things on the list, in that time period we're talking about with young adults, it's also a time period where there's a transition in the relationship with the parents a lot of times, where there's, it goes from when they're kids, the parents are obviously the caretakers, but then around that young adult age, there's a flip where a lot of times the children become to be the caretakers and I can envision a cancer diagnosis making that a lot harder for that transition.
It's very confusing at times and it's hard. Oh my gosh, absolutely. I mean, I've seen patients come to Ullman House where, we had a gentleman there a few months ago. He was 38. I think he had like a 13 or 14-year-old daughter. He had his own life, but his mom was his caretaker, so his wife could be home with his kids. And he's like, "Oh my God, I'm like sharing a room with my mom again. My mom's taking care of me. Like I've been out of this stage for a while." And we did have that conversation of he's like, "I've been taking care of her with her health stuff, and like this is totally flipped in a way I was not prepared for." So another thing I want to point out on this list that really comes to the core of what a lot with Ullman is doing is on the first column, transportation and travel to treatment and housing stability and access to safe lodging. I just want to highlight those from just a place of where Ullman's really plugging in. Transportation and travel to treatment, that's actually the number one reason why people miss cancer doctor's appointments generally, is because they can't get to their appointment. And when you think about people that may live in rural areas that have to travel long distances to get to their doctor's appointments, there might not be public transportation or Ubers where they're living. That is a huge barrier. And you think about the financial cost too of taking a ride share program like Uber to and from an appointment hour away, like that could be $100, if not more, for people. So it's very, that's a huge thing to kind of note of like when you think about why do people miss doctor's appointments, a lot of times it's not because they don't want to go, it's because they don't have the transportation to get there. Um, the housing stability, Ulman House is this is the reason why Ulman House was built. When we recognized 6 years ago that, oh my gosh, people are traveling all over the world to come to world-renowned hospitals in Baltimore, Johns Hopkins, University of Maryland, the NIH down near Bethesda for treatment. And they don't have a place to stay. They're too old to stay at organizations like the Ronald McDonald House. They might feel uncomfortable at other housing lodges where the age skews a little bit older. That's why we were built. And the safe lodging component is all about being able to seclude yourself so you can heal, you can have a safe environment, and you don't have to worry about as many outside germs. Many of our patients can't go to a coffee shop because people are sick and they can't be around germs the same way because their immune systems a lot of times don't even exist while they're going through treatment. I'm trying to think of a few others that stand out to me. Um, the other one I just kind of want to note on here is fertility and reproductive health. This really is a unique one for the adolescent young adult age range. This is that time range, 15 to 39, is when people start thinking about, am I going to have a family? What does that look like? And one thing that all of our Ullman navigators are specifically trained in is having those conversations around fertility. The term is fertility preservation. So if somebody's about to start treatment, a lot of times they will do a sperm sample or they'll do egg retrieval for women to be able to preserve that fertility for them to be able to have a family and children in the future if they decide to. Um, this has changed a lot with cancer therapies like T-cell therapy, and treatment that really goes at the the cancer directly in your body. But historically, chemo and radiation especially, it really damages your whole body, and a lot of times your reproductive health can suffer from that. So this is a unique situation that young children don't often have to deal with or older adults, but that adolescent young adult range, like this is an area I just want to highlight that Ullman really does do specific support around. Um, I'm trying to look at other things. Anyone else just have one or two on here that they're just like, wow, did not even think about that.
I hadn't really heard of chemo brain until my mother was dealing with cancer a couple of years ago. But she expressed that that was definitely a really real thing. And you mentioned T-cell treatment. She also had T-cell treatments
Yeah.
years ago too. And
Brendan, for those that don't know, can you share a little bit about what chemo brain means in your work?
basically it was just kind of like a fog, is how she
Yeah.
explained it to me. Where it was just hard to connect thoughts and it she got mentally tired very easily,
Yep.
and just would struggle to put thoughts together and complete sentences, really. It was just a blur, kind of, so she explained it.
Yeah, thank you so much for sharing
Mhm.
that. And you explained that really well.
Yeah.
I mean, we hear that term constantly. It's like, oh, I'm having chemo brain. Like, sorry that I'm not like fully there today. And it's something that it's real and it's a side effect and it's something that a lot of people struggle with. And you got to think that people that are still working or taking care of their family while they're going through treatment or anybody, but like if you're still trying to work and take care of things and be a normal human and you're dealing with your brain not connecting, and just having a fog of thoughts not coming there, like that's scary. And it's something that your mom is definitely not alone in that feeling. All right. Anything else before we move on? Okay. So one thing that this is a big part of my role is really looking at what is the impact that we're having. And a big part and ways that like I kind of get to the root of that is thinking about what do adolescent young adults need And when we've done surveys, when you look at research, really these are the five things that come up for young adults. They look for connection. They want other people their age to say, "Oh my gosh, I get that. Like I know what that feels like." And a lot of times they're not, like someone said earlier, you're not getting that from your immediate friend circle. They want clear information. I think this is where all of you can appreciate this, is that you're not children. Like you are in a space where you can handle big information, you can make decisions about yourself and your body, and you want those clear informations about what does fertility treatment look like, what do treatment options look like, and what are the long-term effects of any of the treatments you may have while you go through cancer. Um, that is something we hear from young adults of like, don't sugarcoat it. Tell me what is going on with my body. Psychosocial support. So this is the wraparound support services, those mental health support services we talked about. This is access to a therapist. This is support groups with other people, going back to that connection of people that get it. And this is peer programs where maybe they're going to go to the movies one night as a group and maybe they never talk about cancer, but they know they're in a common space with people that just get it. Um, they want navigation help. This is where having a navigator like Ulman has at hospitals throughout Maryland, and hospitals are hiring more navigators too, but that support for them to have someone advocate for them, be able to say, all right, this is what this means. This is how I can help you. Our navigators are doing everything from being in between the doctors and the fam and their family to helping them get access to food, helping them fill out paperwork so they can return to school the following semester. One story that always sticks out to me is we had a navigator at Johns Hopkins a few years ago who told me she had a patient that came in that she's been working with, and the patient was supposed to have surgery, and the patient was terrible saying, "Oh my gosh, like this is routine surgery. You're going to be good. Like you've done this before." So she's looking at their record. But what she didn't know, which is so scary, I mean, I think everyone here could relate to how terrifying this would be. A previous dental surgery, like not related to their cancer at all, the patient woke up in the middle of the surgery. And they were so terrified of going under anesthesia and waking up again, but they also were so terrified to say something to their medical team because they didn't want to stop their treatment of what had to happen. So our navigator now had this information. She could go to the medical team and they actually changed some of their approach and were able to reassure the patient of like what this would look like differently, like having that fear of what and that experience of waking up during surgery, which, oh, I'm sure all of your jaws are on the floor. Like that is just so terrifying. But it was something that we could address that. And I think have if they didn't have the navigator to do that conversation, they would have went into that surgery planned terrified, so much more anxiety, and worry that they didn't have to do as much anymore. I'm sure they were still worried. I would be too. But that always sticks out to me of like just the above and beyond our navigators can do to help people. And there's also just they want normalcy, right? They want the opportunities to stay connected to school, work, social life. We had a patient staying at Ulman House when probably about 3 years ago. She works as a vet. She worked at a veterinarian's office. Her job was to make the appointments for all the animals coming into the office. And she had just had brain surgery, so she's recovering in Ulman House, but she was in a place where she could still work, she can still do everything. So she stayed at Ulman House, recovered from her brain surgery, and still was on the phone every day placing cats, dogs, birds, lizards in their appointments. And it was just very cool to see her come into her own and still have that normalcy of, I'm still going to work. I can do this remotely. And then have the space to still heal and just take care of herself too. So when young adults and adolescents impact advisors say they need stuff, most of the time it falls into one of these buckets. Any thoughts? Okay. So this is really where Ullman kind of comes in to address those needs, right? So we talked about a lot of these tonight in the different barriers, what people experience when they have cancer. Any of the work that I'm doing of measuring impact, looking at ways we can help patients, looking to it's really barriers to care. These five things are usually what comes up for patients is social isolation, especially young adults, when you have a cancer diagnosis, it is incredibly isolating. You are taken from what normal means to you to something totally different. And you could have the amazing support system in the world, but we hear a lot of the time that people still feel lonely or they feel like they don't have people around them that get it. Um, Financial toxicity. Cancer is expensive. It doesn't matter what kind of cancer it is expensive. I could go on a whole tangent about how our insurance systems and medical systems are not helping patients get access to care in a way, but I will hold that for another time. But I can tell you that financial toxicity, when you think about everything that goes around with cancer, we are looking at transportation costs we talked about, how maybe housing if they have to move away from their apartment. You got to think the people staying at Ulman House, it's totally free, which is incredible, but they're still paying for an apartment, a mortgage, most likely while they're still staying at Ulman House, but they're not at their home. At least now they're not spending on a hotel room and a mortgage, right? So that financial toxicity is real. And when you start throwing into just parking at hospitals for appointments, it all adds up. The stress and anxiety, I love how so much of you picked up on the mental health piece of this. It's so real, and it's something that I am so grateful of being part of I feel like, environment and world now where people are taking mental health more seriously than they did when I was your age. I feel so old saying that, but it's real, and it's something that when we look at stress and anxiety, that absolutely impacts the outcomes of people's cancer treatment. So the more that we can reduce that, the more likely they're going to have a better outcome when they are done with treatment. Compliance to treatment. This is looking at do can they plug in with their medical teams? Can they afford what they're doing? Are they able to talk to their doctors about what they're going through? Do they trust their doctors? So these are all things that we can help in to make sure that there is nothing standing in their way to having a good, and it's not always a good experience, but as best of an experience that they can have while they're going through treatment. And then going back to that access to care. Can they get treatment? Is it the right treatment? Um, do they have support if they're living by themselves? I shared with you all earlier that my wound was on my back. I physically couldn't take care of it, so I had to rely on other people. And if I didn't ask about that, like I would have been in that emergency room for a much larger issue. But it's that access to care of like I look back and like I shouldn't have had to do that, and that's something I wish I had talked to my doctor about of like what are other options for me so I'm not dealing with this because I did live alone. So then you look at all of these different things. We really have to look at from the Ulman Foundation perspective, are we reducing barriers to getting access to care, reducing barriers to financial toxicity? And the answer to all those questions is yes. And I think that's what all of you are doing too in the work that you're doing by raising awareness, raising funds, raising support, just letting people know like this is an issue and real. You're helping reduce all of these things because somebody's going to realize they're not alone in their care. Next slide. So again, I know I said this earlier. I'm sure Andrew has said it. We meet families where they are, and this can be in the hospital settings, in their workplaces, community Ulman House. Um, Cancer is not, it's not in your own little box in your own little room. It's everywhere. So we have to meet patients where they are too in that. So a little bit just about the patient and community navigation. So I've been saying that we have patient navigators. These are staff members of the Ulman Foundation that work at hospitals like Johns Hopkins, Walter Reed, Sinai Hospital, University of Maryland Medical Center. And they're doing all of that support that we talked about earlier of stepping in to make sure that whatever issue that patient is experiencing, they're providing that one-on-one support. I mentioned the hospital system. Our community navigation program is also a great resource that it's remote. Anyone in Maryland around the country could reach out to us. And if somebody called us from Salt Lake City, we could talk to them about what they're needing. And we could either find resources for them locally in their community, or we can plug them into any virtual programs and offerings that we may have. So just know that if you know somebody that is not Maryland based, that is in that young adult age range, we can still support them from afar, and they can plug into our remote navigation by doing that. I like to say that Ulman Foundation is really, we're centered here in Maryland, but our reach extends so much further of where we can support people. Next slide. So we talk a lot about Ulman House. I hope all of you have the chance to come visit if you haven't already. It's a truly special place. I just feel honored every day that I get to walk in that big yellow door that you see right there. But we opened in 2019. Since we've opened, and you got to throw in a global pandemic in the middle of that too, we stayed fully operational the past 6 years, that we've saved families $2.3 million in lodging fees. So you got to think about the average hotel cost is about in this area in Baltimore is like 230, 250 a night. So if they have to stay in the hospital for a month, we're talking thousands of dollars that, I mean, no one has that lying around a lot of times. So we're able to step in to ensure that it's totally free. We define it as active treatment. So if they have 2 to 3 appointments a week, they can stay with us. And we've had patients that have stayed with us a night. We've had patients that stayed with us for over a year. So it really, whatever that active treatment looks like for them, we can support them on that. And since we've opened, we've offered 10,000 nights of lodging. And the annual savings for Ulman Health guests is $338,000. So that's money that is probably a second mortgage on their home. It's going into insane debt. This is all just saying that you don't have to worry about that while staying with us. So the impact from reducing that financial toxicity, I mean, the numbers speak for itself here. So just a few photos I threw in about Ulman House. It was 6 row homes that we made into one large 13,000 square foot facility. You can see there, that's the outside of it. Hopkins is barely a 5-minute walk from here. If you go to the next slide, Andrew. And inside, we have a beautiful kitchen. We have 8 private suites where guests can stay. Each room can hold up to four guests, so depending on what the family structure looks like. Usually it's a guest and a caregiver, so that couch that you see pulls out to a full-size bed, and we have a queen mattress there. We have a fitness center where people can work out in. We have game rooms and entertainment spaces around the whole facility. It's a really special place. I don't think I have another slide after that with photos, do I? No. But Ulman House is a super special place. And hope you all have the chance to come visit sometime. One of our programs, and I'm biased, this is my favorite program that we do, is Cancer to 5K. So it is such an impactful program. I like to call it a support group in motion. I've heard some people call it a support group in disguise, that patients come together, survivors, loved ones. It doesn't matter if you've been impacted by cancer in any way, you're welcome to join this group. And people complete over 12 weeks, train for a 5K, and they run or walk it to complete that goal race. And it's just an incredible program to see people come together and complete a goal. I've seen people in the middle of treatment say, I'm going to walk this 5K and I don't care how long it takes me. And I personally have had the chance to run with somebody that was new in survivorship, and she had a PR the first time, at her first race afterwards. So it just is a very cool experience. This is open to anyone to join. So if you are a runner, walker, you know somebody, I can tell you firsthand, I've been involved with this program for 4 years. It's my favorite thing that we do, and it's so impactful. So I've been mentioning support groups. We have a lot of ways for people to plug into us, and we're doing a lot more offerings next year. We actually had a wellness support group today at Ulman House where we had a member of our community that makes organic face masks come in and do face masks for guests. And then we had, I need to put a photo of Tommy up here, but we have a therapy dog that came into our circle, Tommy. He's a golden retriever. So imagine having a face mask and you just get to pet a dog and hang out with other folks. It was a really fun day for people. So we do things like that. We've had groups go axe throwing together. We do a virtual art program called Atto. Atto is the Japanese word for art, and we partner with MICA, which is the Maryland Institute of College of Art, on that, where a fellow from MICA creates programming for people virtually. So they can be located in New York, in Raleigh, in California. It doesn't matter. We'll mail them all the materials. And we had a group last year that all learned how to quilt and then mail back their squares. And then now we have this big blanket that was made by patients, which is really cool. So, I mean, anything is possible with support offerings, and this is where we're trying to get creative to do different offerings to meet people where they are. Actually, next week we're doing our first um, video game support group. So if you know anyone that's into video games, I think they're doing Fortnite next week. They're planning on doing a Mario Kart tournament. They're doing this over. Um, oh my gosh, what is the? It starts with a D. Oh my God, this is what is it called?
Just
Discord?
Thank you. They're doing it over Discord. It's been a long day, team. So, yeah, they're doing it over Discord. There's a lot of information on our website, but if you know anyone that plays video games and just wants to join remotely, like, come on by. It'll be a lot of fun. So anything else, Andrew, after this?
Nope.
So I'm gonna pause there and just first of all, thank you all so much. If you can actually turn off the slideshow, perfect. Thank you all so, so much for the great questions, the thoughts. I want to hold some space for any questions that may come up. Anything about the impact on young adults, the Ulman Foundation, anything that you're thinking, want to leave some space for people to put a question out there or drop it in the chat.
I was wondering if you guys had any student opportunities where we could go and help out at the Ulman House.
Yeah. So, Sandy, great question. The answer is yes. We have an amazing, my colleague Katie, she's our house experience manager, and she is a pro at coming up with volunteer opportunities. But one thing that we have that we actually had one of our, a student from a student from Howard County, but now is at University of Maryland. Um, she came in once a week and just helped out with stuff around the house after school. So she would come up and show up around 2:30, 3 o'clock and help with everything from getting the mail sorted to connecting with patients to helping with a puzzle that we have going on. We always have puzzles going on. So we put her to work in a lot of different ways, but it was something she did regularly and just I can tell you, she really enjoyed it. So if that's something you're interested in doing, I would say connect with Andrew and we can bring Katie in and talk through some opportunities. But the answer is yes, we love having visitors. We love having a packed house of people and always have stuff going on that we can provide support on. The other place, that's like more of an ongoing opportunity, but if anyone ever wants to come in and make a meal at the house, or even just help with some backyard cleanup, we can arrange some days for that to happen. I think built into your program, there's a few opportunities, but certainly happy to discuss some things offline too. And I know Andrew's happy to do that too.
Yeah, absolutely. And we do also have a couple of schools and teams that have already signed up for days at Ulman House. So let us know. We can definitely arrange something, even if it's on a weekend. I can come in on a weekend if that's more convenient for you all too.
Great. All right. So someone, if everyone can just kind of go, I want to just kind of get everyone's thoughts here. So we're making this interactive. Everyone share one thing that they learned tonight. And I'm going to call on people to make this easy. Kayla.
Yeah, so I definitely think it was interesting what you said about like people's prior like poor medical experiences and how that fear impacts like maybe they're too afraid to speak up to a doctor or maybe they're too afraid to just go to a doctor in general. I think that's really impactful for different people.
Oh, thanks, Kayla. I appreciate that that resonated. Joaquin, what do you think?
Hello, can you hear me?
Yes.
I learned about how the 5K works. It's like because it's like last meeting I had like technical difficulties, so it's like really cool how that the with the 5K that you can like run with them. It's really cool to see how like they have what's it called like recovered from
Yeah.
cancer.
Thank you for sharing. Ashley, what do you think?
I think it's really good to know that like there's places like the Almond House that help people that are going through cancer or people that have dealt with it in some way. Because I've always thought that systems like that require like a lot of money in order to like be able to properly help out with people. So it's good to know that there's systems like this that actually help without needing any money.
Thanks, Ashley, for sharing. Yeah, we're doing the work on the back end to raise the money so people can access it for free. So that's great that you pointed that out. Brendan, what do you think?
Excuse me, I learned more just generally about Ulman House and the services you guys provide to cancer patients and their families. And I guess 89,000 young adult diagnoses a year.
Awesome. Thank you. Crosby, what stood out to you tonight?
So it's not that like I learned this, but I guess I didn't really like realize or look at how like much people are affected, like with their social lives and stuff. So I want to ask you because all right, let me back up. So sorry. So my parents, they usually talk about how like in their 20s it was like the best like part of their lives and how they were like always out like having fun. Like what in like particular part of that like impacted you?
Yeah. Um, I'm actually going to be really vulnerable here. I would say, for me, it did negatively impact me that I still kept going out and I still kept going out with my friends. And I think it was something that I needed to slow down a little bit in I needed time to rest. I needed time to take care of myself. I was kind of like in denial that this was happening. So the mental health piece of that really stuck with me in my 20s of I can do it all and I'm fine and I'm okay. And the reality was I wasn't okay because I kept putting in denial with it. Um, and I had a I had a great time in my 20s and I wouldn't change it for anything. But it's something that it was really hard and it's something that I wish I had the therapy and the support that I got later on. So thank you for asking that and thanks for letting me be a little vulnerable. Sophia, what did you take away tonight?
It actually brought up like so I volunteered at the Walter Reed Pediatric Oncology Clinic, and I did notice while I was there that we had a lot of like 20-year-olds and like a little older patients. And while I was there, it was like in the back of my head, like, oh, like there's so many like little children going like in and out of the clinic, but like how do these like older patients like in their 20s and stuff like that, how are they dealing with this, especially if they like come alone? Because the children usually come with like their parents and stuff like that. But seeing like the young adults come alone, I'm like, how are they like dealing with this like all like basically by themselves, especially the transportation aspect and stuff like that. And this meeting like kind of helped, oh my God, sorry. This meeting kind of helped reinforce that. And also in my research paper where I, God, I really need water. In the research paper that I was looking at, or I was making about the differences in like pediatric patients and how chemotherapy and like cancer treatments affect pediatric patients, like a lot of the long-term effects like really came up like even during this presentation. It's really the long-term effects and like the social aspects that we really need to like take into aspect when we're dealing or not dealing, but when we're like looking towards these patients.
Oh, absolutely. Thank you so much for sharing that. And I'd be very curious to read your research paper when you're done. All right, I got two more. Anam.
One thing I learned is that it broadened my perspective of what exactly these patients go through because in the beginning I was only thinking of certain mental health aspects and certain physical aspects. But when you put everything down into the list, it showed that it really affects like how you navigate your life through your family, how you're not able to go to certain events or anything. So it's not only about your social life with friends, but affects how you really grow as a person without experiencing some things that a general body of people would experience
Oh,
and learn through.
thank you so much for sharing that. So well said. And last but not least, Sandy, what are your thoughts?
So the overall presentation, I learned a lot about, different aspects of cancer that I didn't know. Like the amount of young people that are impacted by cancer is really just astonishing and sad. And how they are going through the whole cancer treatment process alone. A lot of it makes me so sad. And I'm really glad that the Ulman Foundation is helping out these patients with like health facilities and the treatment that they need. Well, like the living facilities. And it just makes me really, really happy to hear that.
Oh, well, thank you for sharing that. And I will say it is sad, but I will tell you it takes a village, and there is so many great organizations and doctors and support programs that are out there. We just need to make sure people have better access to everything. Um, Andrew, I'm going to turn it over to you for final thoughts, but I just want to say thank you all so, so much. It was an absolute pleasure speaking with all of you tonight.
Thank you.
Yeah.
Yeah, thank you so much, Kim.
But
Oop. Yep. So that's all that we have for tonight. We're not gonna. I know we're right at time. So if anyone has any final questions, please feel free to reach out, let us know. But thank you all so much for coming out tonight and being so interactive as well. Some great questions, some great thoughts, great comments. Really excited for all that you all learned tonight. Again, we would love to have you all at Ulman House. I know a couple of teams on here have already scheduled some events and volunteer opportunities. But again, any point in time, if you all want to make a trip to Ulman House, let us know. Give us some advance notice so we can make sure it is something that we can actually work out. But let us know that if you do want to come to Ulman House and really see firsthand the impact that you're making, where the funds go to, the Why We Fight wall, we'd love for you all to sign the Why We Fight wall. Really see firsthand everything that you're doing. We would love to have you. But again, thank you all for coming out tonight, for being so interactive, for being so supportive, and doing so many great things through the So Do We program. Really excited. Read your emails. Be on the lookout. Sometimes there's some hidden messages in there, and there's going to be a really cool surprise coming up in the next one as well. So be on the lookout for that as well. But other than that, have a great night. Have a great rest of your week, and have a great holiday season and a new year.
Thank you.
thank you. Happy holidays.
Happy holidays.